Welcome back to Quick Hits, the podcast where we explore the latest trends and innovations in healthcare technology. I'm your host, Tyler Smith, joined by Ken Booth. Today's episode takes a close look at how artificial intelligence is reshaping care delivery with Dr. Nirav Shah, Associate Chief Medical Informatics Officer of AI and Innovation at Endeavor Health. Dr. Shah shares his journey from infectious disease physician to health system leader and how that background helps him approach technology with both clinical understanding and strategic vision. We talk about how Endeavor Health is using AI to reduce clinician burnout, streamline policy workflows, and improve patient and provider experiences through tools like ambient documentation and generative agents. We also discuss the importance of building trust, creating responsible frameworks for AI adoption, and designing technology that supports, rather than replaces, the human side of care. Dr. Shaw offers a clear look at how one health system is preparing to scale innovation across a complex and rapidly changing environment. We're excited to have Dr. Shaw join us to share his experience and perspective on the future of healthcare. Don't forget to subscribe to Quick Hits on your favorite podcast platform and enjoy this conversation with Dr. Nirav Shah.
Welcome to another episode of Quick Hits. I'm your host, Ken Booth, joined as always by my co-host, Tyler Smith. Tyler, how are you today?
Awesome, Ken. Great to be here.
Yeah, glad to have you. And certainly we are excited about today's guest. Today we are interviewing Dr. Nirav Shah. He's the Associate Chief Medical Informatics Officer over AI and Innovation at Endeavor Health. Dr. Shah, welcome to the show.
Thank you, Ken. It's great to be on.
Yeah, we're really excited to speak with you today, and especially when it comes to yours and our favorite topic, AI. But before we kind of get into that, you've had a remarkable career spanning clinical leadership, health system transformation, and digital and AI innovation. So we were hoping you could tell us a little bit about your journey and what drew you into this interesting intersection between medicine and system strategy.
It's a long story and it's a very windy path. I actually thought I was going to do global health. So I'm an infectious disease physician by background, and I was going down that path until I realized, and I would say my wife and girlfriend at that time realized that that didn't make much sense. She was in tech, and so I got interested in tech and happened to connect with a mentor at the time who was the VP of Clinical Analytics and Associate CMIO at North Shore University Health System. So that is a part of Endeavor Health. And Endeavor Health now is a 9-hospital health system in Chicago and the surrounding areas. And so he kind of mentored me in the areas of analytics and informatics and recruited me. And then from there, my journey kind of, the windy path, I went from that to then getting into quality, then into information technology, and then into innovation. And I've always had an interest and a background in research. So I've leveraged all 4 of these skill sets to kind of solve system-wide problems. And that general kind of view to this helps me think about these problems a little bit differently than the typical leader in any individual space.
Excellent. Yeah, that's a great journey there, and we can truly see how you've had such a great impact. You've actually led Endeavor Health through some major transformations. What really helped you to keep clinical care at the center? When you're going through these times of significant change.
Yeah, I mean, I think this is something that leadership at Endeavor and probably across the nation, anyone in healthcare is trying to navigate significant transformation in the healthcare space. And I think it comes down to a few things. And, for me, my vantage point really is AI innovation, digital that's focused on the clinical aspect, but some kind of key areas that I think about are guiding principles. So the first is you have to have the patient outcomes and experience as the ultimate North Star. So at Endeavor, our vision is safe, seamless, and personal. And so that is, thinking about the patient baked into our vision. So as we were coming up with our AI strategy, safe, seamless, and personal was integrated into our AI strategy. And the way that we framed the areas and buckets that we wanted to think about was based on safe, seamless, and personal. So patient outcomes, experience, everything needs to be tied to the ultimate North Star, which is the patient. And then thinking about clinical amplification. So, generally speaking, our guiding principle is to amplify or augment the capabilities of our clinicians, not to automate away their core functions. I mean, there are things that most clinicians want automated away that are low value tasks, and the hope is that we can kind of work with them to automate those things. But in general, those core functions that make a clinician really make them a clinician. So their time, their empathy, their clinical judgment, those are things that we like to amplify. And then making sure that that clinicians, especially when it comes to kind of clinical type workflows, that we are co-creating anything with the clinicians. So making sure that it's not a top down, an IT only endeavor, but it's deep engagement, back and forth, in order to kind of co design, pilot, and iterate with clinicians. And then the last thing, I like to state this, frequently when I talk about AI, but AI will scale at the speed of trust. And I think that's probably the case with pretty much anything. Like change will scale at the speed of trust, transformation will scale at the speed of trust. So making sure that, especially in my area, focusing on AI, that we keep repeating that message and we build that trust as every part of our strategy, every part of our execution.
What would you say the trust level is right now at Endeavor within the providers of AI? And then love to hear also where you think the patients would rate AI in terms of trust.
I think there's probably a pre-ambient world and a post-ambient world, because I think ambient was kind of an aha moment for a lot of clinicians. Generally, clinical folks are quite innovative in general, but and if you think about it, like clinical care in general, if you think about the stuff that surgeons are doing and the guidelines that keep changing, it's very innovative to kind of keep up to date with all this constant change in knowledge. That being said, our workflow is so like we're so good at our workflow, and it's taken years to kind of develop that type of workflow. So any kind of change to that workflow, generally speaking, a clinician will be very resistant to that. That being said, ambient AI, so basically having AI essentially transcribe a clinical visit and then automating the generation of the clinical note, has had probably the fastest adoption of any technology in the healthcare space. And most physicians that we have surveyed within our health system have said that this has been extremely helpful. It's helped with their ability to be present with their patients. It's helped with their ability to be present with their families at home. And so I think pre ambient, there's probably some degree of just like cautiousness around AI and what to expect. And then post, I think there's a real like understanding that AI does have the ability to help take away some of these tasks that traditionally that we've done that have been problematic, or essentially that has taken away from the human kind of interaction.
Yeah, it's interesting because I think some other big AI initiatives that kind of were being touted, but maybe not received as well, is we heard a lot about in-basket messaging. Obviously, we've heard about all the rich data that AI can now make better use of. But it really is fascinating how ambient is the technology that you reference as pre-ambient, post-ambient. In some ways it's like that's the picture everybody used to see of the provider looking at the computer screen, not looking at the patient. That was like the number one argument against EMR. Like it was creating impersonal patient care. And so ambient, it seems, has moved the patient back to the focal point of the provider when they're in the room. Would love to hear what you think might be the next big ambient type epoch, if you will, that will continue to build the trust in AI.
Well, so ambient is a very specific use case within generative AI, and I think there's going to be a lot of specific use cases within generative AI. Our EHR provider is building out hundreds of specific use cases in generative AI across the workflow for all kinds of different types of clinicians, nurses, you name it. So I think there's going to be a lot of those types of small kind of niche solutions that come throughout the workflow for all kinds of different providers. What I would say I'm more excited about is the agentic work that's coming, and we're starting to see companies that are starting to essentially have agentic voice or multimodal capabilities, but agentic voice as well, and thinking about automating entire workflows. So I think that's probably going to be the next kind of iteration of this. That being said, to get to building trust in something like that is going to take some time, and it's going to take a lot of work, and a lot of starting with very foundational capabilities that that you would want automated. You don't want on a clinician's plate, and then slowly kind of progressing and assisting the clinician as that technology kind of gets wider adoption and the technology itself just gets better. But agents, I think, is it's going to be the next big aha moment, I think.
How close do you think we are? I say that being a person who, while I love AI, I admit I get irritated when I receive a call and I quickly realize that it's an automated call. As good as they are today, I don't know that they're close enough to really. I don't know. Do we want to fool people, or does it maybe require that we're upfront and say that this is an automated line and we're going to do an intake over the phone or something along those lines?
So again, I think AI is going to scale at the speed of trust. So transparency is an absolute necessity. If you look at any of the external guidelines, there's all these white papers from all kinds of 3 and 4 letter external organizations like NAM and NIST and FDA and all that. The White House previously had an executive order, and all of these things they talk about transparency as like one of the key pillars. So I think if you are very transparent and if you prime a patient that they will get a phone call, right? If the clinician who is essentially the trusted provider is able to prime the patient that they're going to get a call by an agent that will help to kind of manage some of the care that they're receiving to augment their ability to care for the patient. I think it's different than, if you have some telemarketer or you're calling, like, I don't know, some company to try to get something and, you know, the, um, the agent is not appropriately responding. And then in terms of like the pace at which the technology is changing, I think it's extremely rapid. It's exponential. So what we're seeing in the clinical space is papers that are looking at how AI is working for clinical diagnostics and management and all of that. The papers that are coming out are already completely outdated. They're using models that that were trained like in 2023, 2022, and so things are getting dated pretty quickly. So we're seeing that the pace of change is rapidly happening, and I think the agents will also I think they will rapidly get better as you get more data. And there are even some companies that literally their whole focus of the company is thinking about the emotions that an agent needs to have to make sure that it appropriately reflects what the human is talking about. So, for example, like if you get angry with an agent, generally speaking, it's in the same flat tone that it had the entire conversation. There's literally companies that are coming up trying to make it more responsive to the emotions that the human has. And so as these types of technologies layer into these agents, you're going to see that the ability to communicate with them will be enhanced.
Interesting. Yeah, I'll have to take a look at that. And yeah, I guess you're right. It all comes back to that trust factor? But I really do appreciate the point about transparency, and it probably would be a lot easier if a patient is primed to understand that the purpose is ultimately they get better care because, as you said before, it allows people to be or your clinicians to be more present with the patient, which amplifies that empathy, right?
Yes, exactly.
Let's take a quick break.
At Health Data Movers, we know that data migration isn't just about moving information from point A to point B. It's about making sure your clinical and operational data is accurate, accessible, and secure, so your teams can focus on delivering care, not chasing records. Whether you're consolidating systems, switching EHRs, or sunsetting legacy data platforms, our data migration experts help you move confidently through complex transitions. We bring proven tools, repeatable processes, and deep healthcare experience to make your migration seamless. If you're planning a system change or even thinking about one, let's talk. You can learn more at healthdatamovers.com. Now, back to the show.
Well, Endeavor Health certainly has been recognized for embracing innovation. What other emerging technologies or digital initiatives are you really excited about right now, would you say?
We have quite a bit. We have, in inventorying all the different AI automation type tools, we've kind of counted around 100. So we were a very early adopter, generally speaking, of electronic health record. We were one of the first clients of Epic, which is our EHR. We were one of the first health systems to warehouse our data. So we have a long kind of history of being, first in a variety of different things. We have a very exciting personalized medicine program. In terms of the stuff that I find exciting and that I think is really going to be transformational, again, I think AI is going to be the big thing, and we're thinking about it in kind of different contexts. So we're thinking about it in terms of how do we optimize administrative functions? How do we optimize the clinician experience? How do we optimize the patient experience? And so we're thinking about platforms that can help us solve these three big buckets that, generally speaking, encompasses pretty much every function of a health system. There's a variety of different digital solutions as well that are very interesting. We're about to kick off a virtual nursing pilot as well, which I'm sure other guests have talked about. And I think that's going to be very exciting for our nursing colleagues. But these are some of the areas that I think we're working on building out that I think is going to truly be transformational for Endeavor Health.
Really cool to hear all that innovation, especially in the virtual nursing, like you mentioned. And there just is a lot of buzz around these AI tools, whether it's augmentation, automation, clinical decision support. You mentioned the safe, seamless, and personal. And I think there's a couple other mantras you use. Are those kind of the guiding principles when you are approaching and evaluating tools to implement, that you harken back to make decisions around whether to buy or to adopt, or what are some other guiding principles you use when you're determining whether these tools will really benefit providers and patients?
Yeah, I think probably across IT shops and across health systems, we've had an evolution of thought around what solutions make sense. I think there's the pre-consolidation period where, I think we were trying to always solve for the shiny object, and maybe we didn't have as many. Our process may not have been as thoughtful. For us, we've kind of just undergone a variety of mergers. So we're essentially 4 hospital/health systems that have come together in the last few years. And so now our thought process is more along the lines of figuring out how to reduce our technical debt and thinking about platforms over point solutions. So generally speaking, when we're thinking about a solution that we want to integrate, a new solution, we think about, how is it going to solve a variety of different problems that we have, not just a single point solution. I think that type of framing is probably occurring at most health systems right now. So that's probably the primary way that I would frame it. Is it a platform solution versus a point solution? Then you could probably layer in, a variety of different considerations, such as, is there interoperability with our existing solutions? What is the workflow component to this? Obviously pricing as well. How is the vendor going to partner with you on this? So there's a variety of different things that, we also consider, like what's the take from some of our partner health systems on a specific solution? So does it have buy-in? Does it have staying power? A variety of things like that.
Yeah, super fascinating. And we've been blessed to be able to work with Endeavor on the passport project. And really impressive how, three or more, you may correct me, instances of Epic being combined into one. And yeah, really interesting point then. So it sounds like, and there is so much consolidation in healthcare, obviously at Endeavor, but then across the country, and platforms being put over point solutions makes a ton of sense, because then you're already proactively prepared for larger scale. But yeah, curious to other ways that you ensure that you all maintain high quality care, clinician alignment, and consistent workflows as consolidation occurs.
So this is an area that so I'm not over. But that being said, I'll give you my thought process, and I do have one kind of specific use case that I can highlight that we're actively working on. So I think of a hospital as a conglomerate. And then when you have hospitals merging with other hospitals, these are like conglomerates merging with conglomerates. And the integration process, I think, is extremely, extremely challenging. And being able to manage and maintain high quality care, clinical alignment, consistent workflows, I think, is a challenge that most health systems that have merged face. So I think there's a few things that I would think about, which is making sure that when you integrate, you're integrating all functions of the health system from day one, or even before you start the process of it. So not just IT or financial, corporate areas, but also clinical integration. And then thinking through how do we standardize process? Because, like you mentioned, we have three. So you're correct. We do have three instances of Epic from four health systems at slash hospitals, and we can't have a standardized workflow if we're managing three different instances of our EHR. So making sure that we standardize our process so that we reduce kind of like the policy and kind of the debt required to manage all of that is very critical. But making sure that you're thoughtful when you do customize, because there are going to be instances where you do customize because not everything is standardizable. And then the final piece is really kind of leveraging technology to help as an integrator and enabler of this type of standardization or consistency. And I'll give you the example that we're currently working on, and we're doing it kind of in parallel with our EHR integration, which is thinking through our policy integration. So policies should come from evidence-based practice and some of our the regulatory bodies that dictate you should do this versus that, and then that should dictate workflows. And if you think about how many policies a hospital has or a health system has, and then you multiply it by four. So we have tons and tons of policies. We have around 10,000 policies across our system. And that is a lot, that we have built over years and decades. So one of the things that I'm working on is using AI to help us think about consolidating these policies much faster than it would typically take. So I'll give you an example. It took a team of 20 nurses and quality team members about 3 months to consolidate a single policy. It was an infection control nursing type policy, but 3 months, 20 people for a single policy, and we have 10,000 policies we need to consolidate.
Wow.
Think about how much time nurses, quality team members would spend doing that
Yeah.
if we had to consolidate that, right? Going line by line, trying to understand what are the differences, the similarities, how do we do that? So when we looked at this problem and when we were approached to kind of help with this problem, we took a completely different approach. We're like, we can't take the time to do this manually. We can't look at like four distinct policies and think about this, figuring out how to integrate each piece of each, and taking this to our SMEs and all that. So what we're doing is we are reducing the dimensionality. So from 10,000 policies, we're finding 30 big domains, and everything will fit in those 30 main domains. So we used to have 500 unique owners of these 10,000 policies. So we're reducing that to the 30 domains having specific owners, and then they fish out the SMEs. And those 30 things, when we're thinking about the domains, we're thinking about a post Gen AI world. Because, traditionally, we needed all these small policies so that you can click on it on a website. So if you wanted to look for something, you can find the specific policy you want. In a post Gen AI world, everything is going to be ingested by a Gen AI tool, and then you're going to be able to communicate with it. So it doesn't matter, how it's kind of laid out. You can just kind of reduce the dimensionality, and it's totally fine. And then what we're doing is we're starting from scratch. We're building a new policy with evidence-based practice and the appropriate like regulatory body standards. And then we're going to be integrating essentially all of the complexity from all of our existing policies into that new policy. We figured out how to do this with 3 prompts, and we're probably getting about 80-90% of the way there. Then, so that's probably like half the battle, and we're able to do it in about 5 minutes. And then we can, send it off to do all the SME kind of collation and figuring out what's the best way to do this for a system and making sure that appropriate customizations exist, and then taking it to the internal regulatory bodies. That's like the second piece, which also is going to take time. But if we can reduce the time by about 50%, this is like extremely valuable.
Yeah, I was just going to ask how many how many prompts. So 3. That's pretty impressive, and that really shows that you've obviously worked through your process. And you said it would save you about 50% of your time.
I think so. I mean, I think we're going to get most of the way there. And you know what? This is where generative AI is amazing, because it can create a novel policy. It'll create, so we're not going to be stuck on like whose policy is going to win out. But, and that is half the battle. Like no one wants to change, and we have multiple different ways of doing things. So we're creating a novel policy, and then we're able to kind of integrate some of the and surface some of the differences and similarities between these policies.
Mm-hmm.
So when it's surfaced like that, then you can make decisions very quickly. And we're going to message this as a novel policy for the system. This is now our Endeavor way of doing it. This isn't, like one of our specific entities' way of doing it, and everyone has to take this. So, part of it is we're able to message this a little bit differently. We're able to surface the differences, and we're going to be able to make the decisions a lot faster than if we had done it in a typical pre-AI manual way.
Well, it also sounds like a great workflow to reduce burnout for the policy creation, which then brings up the thought of clinician burnout, which I don't know the exact figures, but I think we can all agree there's not enough providers for our current health system, and if we burn out the ones we have, then we're in real trouble. So, would love to hear what are any strategies you've seen or implementing to support care teams that are leveraging AI.
So there's this famous paper that basically said that a primary care provider, in order to do every guideline-based practice for a given patient, would take like 26 hours in a day, right? So it's very clear the burdens on physicians are just, they don't make any sense, right? It just doesn't make any sense. And then there's also like, the shortage of physicians, of nurses, and that's a policy-related shortage more than anything else. So then how do you deal with that? So you got to take off a lot of the stuff that's really algorithmic, has to be taken off the plate of the clinician. And, some of these things where there's clear guidance as to what to do, what not to do, that should be taken off the plate of a physician. Anything that requires, anything that takes time, where an AI solution, like I mentioned, like the policy solution, if we're able to summarize like what has happened since the last visit and surface it in a very thoughtful way, that the physician, can, ingest in a very short amount of time with the appropriate kind of controls to make sure that you can, reference it and go back as needed. Like these are some of the solutions that are going to help amplify or augment the clinician. So now in thinking about how as a health system we need to support clinicians, and I would say even our support teams that support the clinicians, we need to be able to ingest a lot of different AI solutions that help with the thousands of different workflows that exist across our enterprise. And the way to do that is to have a very thoughtful process of clearing AI solutions and validating them and doing it in a, like making sure that it's safe, ethical, accurate, transparent, variety of different things. And so we're starting to see in, the literature, there is now approaches to do this for generative AI. We've traditionally done this, in a very centralized and waterfall way for predictive analytics, but we're starting to see there's like a different way to validate these types of models for generative AI. There's probably going to be a different way to do it for agents. But how do we think about doing it instead of waterfall, where every decision then leads to the next wave? How do we do this in a very agile way so we do things very quickly and adapt as needed? And then not only traditionally we've done things in a very centralized way, which really reduces the ability to do lots of things at the same time because you have a central body that's slowing things down. We're thinking very carefully about how do we decentralize this, because everybody's workflow in the next 5-10 years is going to have AI infused. And if you have a central clearinghouse, you're not going to be able to get to everything. So we got to think about it agilely. We have to think about it in a decentralized way. So that's some of the work that I'm thinking about, is how do we set up our organization to ingest all of the different solutions that are going to come from our platforms around this.
One objection I've heard from hospital system buyers, which makes a ton of sense, is, not being clear on what's going to happen with all the data from these vendors, and sometimes getting unclear answers, which then kind of derail the vendor from even being considered. I'm wondering if vendors have caught on to that, and now are being more transparent, or even more buyer friendly in terms of what will happen with the data, because it's obviously extremely valuable.
Yeah, I mean, it's very clear that anything that goes into any AI vendor or any vendor like that, all the data that we're using to make that specific insight or that summarization or that whatever that generated instrument is that you're creating from it, all of that data is going in to make their models better. So the data that we are providing, and the solution that we're paying for in the end is making their tool better, and it is driving the success of their tool. So I think where health systems I think have matured a little bit is a lot of health systems now have like VC arms, and investment arms that are really thinking about how do we partner. If it's a startup, how do we partner with the startup so their success is our success? And so that's one way where even if you're providing the data and you're helping them grow, it's something where their growth is, their growth and success is our growth and success. So that's one way that health systems manage that. But there is an expectation that if they're collecting data to give you some kind of output, that they're using that to train their models, and to make them better.
All right, well, Dr. Shah, as the Chief Medical Informatics Officer, focusing on AI and innovation, what's one major goal or challenge that you're currently focused on solving that you think is solvable within the next year and a half, specifically at Endeavor Health?
Yeah, so I mean, I'm focused on a lot of things because there's a lot of things coming our way with AI. I think the biggest problem that all health systems are going to have to figure out is how do you ingest the sheer number of use cases within AI that are coming from our platforms, like our EHR vendors and other vendors that are, that leverage AI. And I think that is trying to do that in a comprehensive, trusted, responsible framework that is agile and that you can scale is, I think, going to be the challenge for all health systems. And that's the one that I'm thinking about the most.
It's interesting you mentioned that. Just to kind of sidetrack for a second, I saw a recent theory that AI is right now training on its own data, which will kind of water it down. But here, if we're talking about use cases being brought in specifically through your health system, I mean that solves that problem, right? I mean your models are training on real use cases, real data. Accurate?
Yeah, I mean, I think the solutions that we have, I mean, and so another kind of thing that we're thinking about when it comes to deploying AI is, we do not have the ability to be a custom shop. So we're leveraging our vendors to do that, because no one is going. I mean, I won't say no one. There are health systems that are building their own large language models, but very few would think about doing that. So we do go down the space of leveraging vendors, and then the vendors, if we think about our conversation, if we're thinking about platforms and multiple solutions within those platforms, that's kind of how we're thinking about it. And if they're a platform solution for us, they're going to be solving our problems, and we're going to be using our data to solve those problems. So they're going to be training on our data.
Excellent. Oh, good. So, lastly, if you could give one piece of advice to a rising clinical leader who looks at really like this landscape that's always changing, like you said earlier, white papers are out of date, and that's certainly going to continue happening as we rapidly advance. What's that one piece of advice that you would give to that leader?
Yeah, I think change is accelerating, and it's accelerating faster and faster. Like, AI is extremely transformational, and it's the growth and speed at which it's changing is exponential. So for a clinical leader, I think the most important thing is to cultivate a dual fluency. So you have to deeply understand the human experience of healthcare.
Mm-hmm.
So not only for your patients, but also for your care teams, the teams that you lead, while simultaneously embracing and critically evaluating the transformative and exponential growth of emerging technologies such as AI. So you have to know how to solve both of those things. So a clinical leader can be focused on a narrow niche area, such as ambulatory operations or quality in this specific area. But I think those are two skills that every clinical leader, no matter what their siloed area is, really needs to understand.
Excellent. Well, thank you so much, Dr. Shah, for joining us here on Quick Hits. Really appreciate your insights, and I love that mantra of just safe, seamless, and personal. Definitely something I
Mm-hmm.
could see us just using in our own initiatives. So, again, thank you so much for joining us.
Yep. Thank you.
Thanks again for listening to Quick Hits, a healthcare technology podcast for healthcare technology professionals. Follow us on Spotify or Apple Podcasts, and don't forget to reach out to us with feedback, suggestions, or even people in the healthcare technology industry you think we should interview. Send an email to quickhits@healthdatamovers.com.